what is sports medicine going to be in Las Vegas in the next 2, 5, 10 years?
Wow. I think sports medicine in Las Vegas is going to continue on a vertical trajectory in Las Vegas. I think with the Las Vegas Knights, you have summer leagues here, you have G leagues here, you have people coming here regularly outside of pro sports leagues trying to get a finger on the pulse here. I think Las Vegas is going to be one of those places, not only in the United States, but in the world, that everyone's going to look at, oh, that's happening in Las Vegas, that's where it is.
I agree with you. I also think you can't bet too big on Vegas. Dr. Navdeep Singh, it's a pleasure to have you here. Thanks so much for being here as well. Just a couple things about you. You're a board-certified internal medicine specialist. You are the chief medical officer for the Las Vegas Raiders, and you're part of the NFL Physician Society as well. Very happy to have you here on the podcast today.
Thanks for having me.
Yeah, you're welcome, and we've got lots to talk about. So, Las Vegas is the new sports mecca for professional sports, and as a result of that, it is becoming the sports mecca for sports medicine as well. You are a sports medicine physician. We've got that and lots of other things to talk about as well. Okay, so let's start with you. Where'd you grow up? Let's talk about your origin story. So, where'd you grow up?
I grew up in a small city in the East Bay, just east of Berkeley, California, called Castro Valley, California.
So, when did you know you wanted to go to medical school?
I would say early on. My parents were both blue-collar workers in the Bay Area, and both of them sustained major injuries in their jobs. My mom, who worked at a cookie factory, almost lost her left arm in an industrial accident in 1984. My father, who was a longshoreman, had a major injury to one of his legs. And when you look at our culture, our physicians are considered ones that are healers. Physicians are ones that are considered leaders. And if it's something that you strive to, and you take that in the background of our faith, which I'm a Sikh by faith, doing things for others is part of our creed. Mm-hmm. So it seemed to be a natural fit for me.
But no family history of physicians either.
No family histories. And it was more, like many cultures, it was my parents' influence that said, this is where we want you to go, and these are all the reasons why we think you should do it, which led to that decision.
We, as a school, Kierkegaard School of Medicine, we're very proud of, among other things, our first-generation physicians, and it's nice to have one sitting in front of me here as well. We're going to get to this in a minute because you did some of your training in Las Vegas also. Had you been to India before you went to med school?
I had not.
You did your residency at the University of Nevada, Reno Medical School, right?
That's correct.
It actually was held in Las Vegas.
It was in Reno. We would travel to Las Vegas for regional conferences that were shared within the state.
Yeah. Yeah, so we're going to consider you a local at this point. Okay. And so continue on, because this journey ends up with you being a chief medical officer for a national football team. So let us keep going. Let us know.
Yeah, so as you get towards the end of schooling, you have to try to decide what you want to do within medicine. And for me, I was always one who wanted to be able to handle situations, no matter what the situation was. I think being a physician, I'd rather know what to do if I came across a situation at any time than not. And I was really influenced in probably my last year when I was in India in 1999. I was on vacation in the mountains with a group of friends, and this is almost like going up to Lake Tahoe. You're up in a really high peak. I was coming back on a Sunday night, and the car that I was in was involved in a major accident. The car went off of a cliff, dropped about 50 to 60 feet. And it was in a place where there was nobody around at the time. It was dark. There was not much technology. I ended up escaping that accident without much, but a few of the people that were with me didn't. One of them died in that accident.
Oh, no.
The other had a major spinal cord injury, and the third survived. So that entire process of being involved in that accident and watching what happened to others, it made me feel very helpless in the middle of nowhere. What could I do to try to help them? And that led me to the path that I took, which was ultimately in critical care medicine. I always wanted to be in a position where I could save someone's life, no matter what the cost.
Wow. Thanks for sharing that. I can't even imagine what that would have been like. Dark, without having resources around you and so forth. Do you mind talking a little bit more about that and like what actually happened after the accident and how you, got back to civilization and so forth?
Sure. After that accident, and after you learned about someone who died with you who was sitting right next to me, in fact, and we went out the same window of the car. And when you learned about another person who wasn't able potentially to walk for the rest of their life, you become very sober very quickly about what just happened at a young age. It took me a while to get through that, to try to understand why did I escape this accident and why did not they? It took some time, it took a lot of family support, but I was able to quickly dial back in because I was now entering the field of medicine, which would allow me to help people that just went through something that I just went through. So as quickly as I got back to studying and as quickly as I entered medicine, it just pushed me forward. It really gave me, in addition to the idea of what it means to become a physician, it really propelled me forward in saying, you have to be good at what you do every single day.
This reminds me of a question that we often ask in our podcast at the end, but you're bringing up this story and these thoughts, so I want to ask it now. What is your North Star? What is the thing that guides you forward?
It's always been, for me, it's always been you have to do better for other people. It's never about you, whether that's your own family, whether that's people that you meet in the workplace, whether that's people that you meet in the street. We're here for a reason, and we're here to help other people. Mm-hmm. And that has, almost like Hesterprin from way back when, it's burned inside of me that you should never not try to do things for others. And I think that's ultimately what led me to continuing to follow this path that I followed.
I applaud you for this. A lot of times, some of the worst experiences we've had turn into be the greatest experiences we've had if we let them. And it sounds like you've not only let that happen, but you've been intentional about being able to contribute and use that as fuel to drive you, which I think is phenomenal. So again, thank you for sharing that story. You also had an accident when you were young. Different, but an accident when you were young as a fledgling skateboarder, right?
Sure. I think if I ever caught my 12-year-old on a skateboard, he'd be in big trouble. But but back then I was riding a skateboard, and I shouldn't have ridden a skateboard because my parents never wanted me to have one. So I was with a group of friends. I borrowed it, and we were just going down our street, and I was almost at home, and a car sped up behind us and was actually, I believe, in the wrong side of the road and hit me, and I flew over the bonnet of the car and the hood, and I ended up on the ground. I broke a couple of bones, stayed in the hospital for about a week, but that was my first taste of a major accident.
I just think about that situation and the horrific situation that you described, and earlier when we were talking about the skateboard situation, you were so positive about what happened as a result of that, and in the time that we've known each other, I've always known you to be that way, very authentic, very positive, and I'm sure that you bring that to your patients as well, and they appreciate it. So thank you on behalf of everybody that you touch, as far as that's concerned. So let's talk a little bit more about what you do. You're chief medical officer for an NFL team. Do you also have a private practice outside of that?
I do. So in Castro Valley, California, I was recruited to come back there in, I think, 2009. Prior to that time, I was living in Pittsburgh, Pennsylvania, and we started our family, and my parents lived there, and we wanted to see what was best for everyone. So the hospital system in the city that I grew up in, as part of Sutter Health, was developing a new hospital system for neuro and trauma services. And I came back to help develop critical care and pulmonology services in the hospital and in the community. And back then, things were still antiquated. They weren't up to speed. So I began a practice of internal medicine and pulmonary medicine in the outpatient arena, while on the inside of the hospital, I started doing critical care work and pulmonary consultation.
So, we use terms outpatient, inpatient, and so forth a lot, but what do you mean by that?
So an outpatient practice is the one that you're in where patients come to see you. You have an appointment. They come to see you for either your area of expertise or an annual physical examination. It's what we're all normally accustomed to. The inpatient world is what happens when you're inside of the hospital. So someone has been admitted to the hospital for a medical condition like pneumonia, or they've been admitted as part of a trauma process and they've had a chest injury or a head injury and they need to be monitored in the hospital. You help provide care for them while they're in the inpatient setting.
What do you find is the difference in how you're dealing with patients, whether they're outpatient or inpatient?
I think on number one, I think you treat everybody the same. It sounds like it's been overblown, but you treat people not like you want yourself to be treated, but how you treat someone you care about the most. So when somebody is coming to you and they're looking for guidance because they have something either scary that's happened to them or concerning, or they just need reassurance. This day and age, where you don't have much time to spend with patients, taking more time with people goes a long way. Mm-hmm. It helps get them through a lot of the mental side of why they're there. I think on the inpatient side of things, you're talking to families. Someone just got into a motor vehicle accident, and whether they're on a mechanical ventilator in the intensive care unit or if they're on the ward and they have major trauma, it's really, really, really a situation that no one has prepared for. There's so much uncertainty. Inside the workplace, there's so many physicians inside the hospital that come to see you. Sometimes physicians are only looking through their own lens of why they're there, and sometimes you're giving people a bigger holistic picture or a head-to-toe picture. So I think communication on the outpatient side in your office and communication on the inpatient side are two of the things that are foundations for how you provide care.
Yeah, I think in particular the inpatient situation, like you said, people aren't prepared for it, not expecting it, and in a lot of ways they're as vulnerable as they've ever been in their whole lives. And the communication piece is critically important as well. The mental side of it that you just spoke about, I have an idea of what you're talking about there, but can you go a little bit further? Because we're going to move this into the professional sports arena a little bit later, but the mental side of dealing with patients in general, what would you say about that?
So I've had I've been fortunate enough to be able to practice back to the outpatient setting as not only an internist, but also as a specialist. And on the inpatient side, I've been able to go and take care of the sickest of the sick, those that aren't as ill but require hospitalization, able to go into emergency rooms and able to go into the operating rooms for procedures that I do. So I have a pretty good understanding of the spectrum of what happens. When you deal with the sickest of the sick, the ICU patients, for a very long period of time, you're dealing with cardiac arrest, you're dealing with respiratory arrest, and you've done those things 24 hours a day over time. It's never the same, but it's what you do. It's what you've trained to do and what you're good at. So if you can always take care of someone who's at their worst or in the worst possible situation, everything tends to become a little bit easier. I think that's number one. I think number two is the challenge of getting back to communication and taking care of patients and families, because there's a lot of questions that come your way. You want to make sure you organize those answers in a concerted way, not only with what you do, but with what everybody does. And I think in healthcare today, we don't do good enough of a job of that. And in our organization at the time, we made it very clear that anybody who comes into our ICUs, we all speak with the same voice and make sure we're all on the same page. And that really pays dividends when you do it that way.
It's incredibly frustrating for a patient if you're hearing different stories from different people. So the other side of that is it's incredibly comforting if you're hearing the same voice, regardless of who it is that's talking. So yeah, I think that's fantastic. So how long have you been an NFL physician?
I joined the Oakland Raiders in 2011. So this is going on year 15 for me.
So you are back home at the hospital, developing that program. You have joined the Oakland Raiders at the time. What was it that drew you to the Oakland Raiders to work with professional athletes?
So that's a very good question. And I think at the time when I started my practice, I had a bit of more time to figure out how I was going to do things, developing process for my outpatient practice and the inpatient side of things. And I received a phone call one day from the head athletic trainer of the Oakland Raiders, who's now one of my closest friends. He's retired now. But they had lost their team internist, and they were looking for a replacement. And in the group of physicians that were involved with the Oakland Raiders at the time, they were the ones that generated a list of physicians who could potentially fill the void, and my name came up on that list. And, this is one thing that most people don't understand is this is not for everybody. It could be high pressure. Mm-hmm. It's a lot of time away from your family and your work, and it takes a lot. And when I went down and I met this person, I asked a lot of questions, and my first question was about some of the things I think we're going to talk about was, I want to be able to take care of patients the way that I take care of patients. I've heard things, I've seen things, I don't know how real they are. And with 100% assurance is that we do what's right for our player patients every time, and that's how we go. And that was the starting of the conversation. Spoke to my wife about it, and she said, why don't you give it a try? And if you don't like it, you can always pull out later. And here we are 15 years later.
It sounds like your wife's a smart person. So that's interesting that you just said that, because I think one of the things that at least we're led to believe from movies, North Dallas 40, Any Given Sunday, et cetera, movies about professional football, is that a lot of times the physicians are sort of forced into making decisions to get the player back on the field, even if the player shouldn't be back on the field. Do you run into that? How do you deal with that? It sounds like the team had already made a decision about that, but that's not public perception.
Yeah, and I think that public perception, which you're speaking of, I'm glad you asked this question, is untrue in our organization. And I think I remember watching those movies when I was younger, and I used to think to myself, wow, what are they doing back there? You take an oath, you try to do what's right. Is this real or not? And from day one, when I met this person, and I realized this person, who was our former head athletic trainer, lived those values. And he brought those values, and he wanted people around him to not only take good care of his players and his staff, but also to make everyone else around him. And I received that assurance from day one. And I have never come across a situation where we have put the game or the sport in front of safety, health and safety. It just hasn't happened. Mm-hmm. And it's a good feeling, which is probably why I'm still with the team.
Yeah. I mean, I would imagine for you especially, if there was a conflict between your job and your values, you would choose your values.
Yeah, it would have been a non-starter,
to
tell you the truth.
Yeah, that's great. So kind of walk us through what you do as an NFL physician. You've got your private practice, but during season, let's talk about that. During season, what do you do?
So it depends on the type of season. So or the time of season. Once you get through the Super Bowl, there's a little bit of downtime for the teams. And, the next thing that you start preparing for is the NFL Combine, which takes place in Indianapolis every year. That's where a select group of players are invited that are going to be drafted into the NFL. And in addition to all the things that you see on TV about strength and speed and other things, the NFL Physician Society descends into Indianapolis, and we provide medical examinations, both from an internal medicine perspective and also from an orthopedic perspective, to make sure that these players are healthy, to make sure we don't find any red flags that may affect their game in the future. And that's really what we do now. That leads into discussions with our own organization, preparing our draft board, making sure that there's nothing that would put us in a situation that we wouldn't want a player because of a concern that we may have. And that takes place through the draft. We start doing physical examinations for our existing players that tend to come in early on. We have a couple of different pools. We're examining free agents that come in. We're examining players that may not have been invited to the NFL Combine that are great collegiate athletes. You've heard about the undrafted.
Yeah.
There's several of those players that are out there. And so we make sure that they're fit for practice. And once we get through that, there's a few camps and off-season activities that take place, break for summer, and then it really starts in training camp in the summer.
So there's not really a big time off for you. I mean, you've got just a little bit of time in the summer, and you're at it the whole rest of the year.
Yes, and the medical staff that we have, care amongst NFL teams is driven primarily by the athletic trainers. They are the nucleus. They drive all the care. We're spokes to their care. They're the ones that are inside the practice facilities every day. And we can be there more, we can be there less. It really depends on the situation. This day and age with our phones and things like that, we're on the phone several times in the day if concerns arise. And we get through Monday through Friday that way. I'm
glad you're giving props to the athletic trainers, because I don't know that they necessarily get the recognition that they deserve. I mean, they do, they work tirelessly. One of my very dear friends has been an athletic trainer for a long time. It's crazy the hours that they work and the care that they give to the athletes.
I think I couldn't have said it better. I mean, they are so dedicated to their craft. They are so intelligent. They spend hours upon hours making sure that everything that they do is on the money. Mm-hmm. The person that I was speaking to you about before, Rod Martin, our former head athletic trainer, I learned so much from him. I watched him be a master at his craft. And I've watched our trainers now, and I think that's another reason why I'm so aligned with this organization, is because we all think the same way. We all, we're up to the point now where we all think the same way, we behave the same way. We just, through nonverbal cues, we kind of know what each other are talking about. Mm-hmm. We're a really tight-knit unit. And there are no harder-working group of providers, I think, in the NFL than the athletic trainers. Yeah. They're really special.
And I think we could extend that down to the college and even high school levels as well, and they work tirelessly. I want to go back to something that you said. You talked about as soon as the Super Bowl is over. So the Raiders, for example, weren't in the Super Bowl this year. They will be next year, right?
You better believe it.
Okay. So, but you're still working with the team and teams, even though your team isn't in the Super Bowl. How does that work?
Well, so, the thing about the physicians in the NFL Physician Society, when we get together at the NFL Combine, I mean, we're all friends, we're all colleagues. These are people that are present throughout the entire United States. If I'm ever in a situation, or if I've ever had a former player, if I need some help when I'm in New York or in Miami or wherever you name it, I can call someone because we've been together for so long. We all understand the job that we have and the world that we live in. So when other teams came to, two of the teams that aren't too much aligned with the Raiders came to Las Vegas for the Super Bowl, our job was to help them understand our local medical care system. How can we help you when you're in our practice facility or elsewhere? How can we help you if you need little things that you may not be around? So a few of us were around, making sure that we were available to them and making sure that they were as successful as they needed to be.
I want to dive into this a little bit, because I got to tell you, when we very first talked about this, it was really surprising that you've got NFL teams who compete at tooth and nail, against each other, but the physicians are cooperating with each other. I mean, it's amazing to me that happens. It makes sense in a way, in like a perfect world, but can you talk about that? Like, the physicians are working together even though they're on different teams.
Yeah, so before, let me go back about 8 or 9 years ago, before we had what's called a visiting team medical liaison. If I was in another city like Pittsburgh and I needed help for one of my players, if something happened, or one of my staff members, I would just pick up the phone and call my peer and say, hey, here's the situation. I don't know where to go specifically. Can you help me? People will bend over backwards to help you, because we're all, at the end of the day, in the same boat. We understand the work that we do. We understand that we don't want to be behind. We don't want to miss things. We want to be there just for our peers, like we are for our own teams. And amongst the medical side of it, I can speak for the internists. Everybody feels the same way. It's not about, at the end of the day, if we make it to the Super Bowl or someone else does, or we lose to them, it's it's the rivalry amongst teams, not amongst, I would say, the brethren amongst physicians, right? So it's a little bit different on how we see things.
Yeah, I think it's fantastic, right? Because everybody gets to learn from each other. As a result, the players are safer and more well taken care of. It's just surprising to me that in such a competitive world of professional football that you would have that. So I think it's great, actually, that they've done it. Who was it, or I guess how was it, that you came to this? Because I would imagine there was a time where it wasn't quite as symbiotic in the NFL.
As long as I've been doing this, and this, you meet everybody in one place at the same time at the NFL Combine. And at the Combine, the physicians are sharing the work. I mean, when you enter the medical rooms, I'm at a table with a physician from the Philadelphia Eagles or from the Washington Commanders or the San Francisco 49ers. And we talk about, before we start, we talk about things in your family and how things are going. And we examine players together. We look at the data together. When we're jotting down some of the data to take back with us, I didn't catch what someone said. Did you hear that? Yes. If I miss something throughout the week, I may just pick up the phone and call any of them. So it starts at the Combine. And then as you go through the journey of the regular season, you meet everybody if you're traveling or if they come. And I personally try to meet up with my peers before the game to break bread. Hey, how are things going? And I've done that a few times in the San Francisco Bay Area, and we've tried to do it more here because it's a really good group of people to be around. They all have their own skill set that they bring to the table. We have commonalities in our stories, and they're just overall very good people that I would want to invite to my home.
Which is fantastic, I think. Okay, you've convinced me that I want to be a sports medicine physician. So how do I do that? If I'm a medical student, how do you become a sports medicine physician? How do you work with a professional team?
Yeah, so I think there's two things. I think number one, are you someone who specializes in orthopedics or sports medicine, or are you a practicing physician that takes care of athletes? I started out in the second side of it, right? I'm an internist, I'm a pulmonologist, I'm an intensivist, and when you look, how does that equate to what we're doing on the field? Well, it starts that, everybody can have things that happen to them. It doesn't have to be a concussion. It doesn't have to be a shoulder injury. It doesn't have to be some of those things that we see that are related to injury on the field. People can get major trauma as part of a game. People can get medical problems as part of their journey. You can find things unexpectedly during an examination. Cancers, for example, in younger people. So what I found is that no matter what you do, you really need to be at the top of your game. Now that's easier said than done, right? Every day when you wake up, you have to ask yourself when you go to work, what am I doing and why am I doing it? Do I want to be kind of good at it, or do I want to bring it every day in how I was trained? I think you have to be, number one, excellent at what you do. You have to be a good communicator, and you have to believe in what you're doing. And I think when you start just by doing that, opportunities arise. Opportunities present themselves.
Is there training that you go through that NFL physicians go through, or for that matter, professional sports physicians, that help you level up your game?
Yes. So throughout the past, I would say 5 to 7 years, at the NFL Combine, we have a medical meeting. And in the medical rooms, we present unique case reports that happen across the league. Getting right back to what I discussed with you is things happen that are not related to the football field or what you do as part of your organization. Those are incredibly valuable. We'll routinely get updates on practice changing patterns like concussion, like protective equipment, like things that happen in terms of cardiac arrest. Last year we saw the on Monday Night Football with Damar Hamlin. Mm-hmm. And as soon as we identify things, whether they're traumatic in nature or if they are non-traumatic in nature, we find ways to learn about those right away, and then we get periodic updates. I think 2 years ago, Dr. Alan Sills, who's the chief medical officer of the NFL, made it a point to have meetings on both sides of the country and invite team physicians about periodic updates as to what's happening in a head-to-toe fashion that's important to them.
It's, the picture that you're painting is you have a profession, physicians or athletic trainers, as we talked about before, and they are in a high-pressure situation because the stakes are very high, and they need to level up their game as well. How do you deal with that pressure?
So I think getting back to my background of dealing in situations where you're about to put someone on life support, or you're running into a situation of a cardiac arrest. So I'm used to being in those high pressure situations. It's a little bit different when, to your point, when you have situations where you're on the sideline and you want to see if a player is eligible to go back in the game. It's almost a no-brainer now. It's player health and safety is at the center of everything we do. Our orthopedic physicians, our athletic trainers, they're highly skilled and they're highly experienced. And if they feel that we can't go back on the field for A, B, C, and D, or whether we need more data points like an x-ray or even potentially go to the local hospital, then that's what we do. No questions asked.
So I hear what you're saying. I'm going to push on this one a little bit, right? Because I'll tell you a very short story. A golfer and a surgeon walk into a bar one day. This is actually not a joke. This is two friends of mine walked into the bar, and they're both top of the game, golfer and surgeon. And we're having this conversation, and the golfer asks the surgeon, he's a trauma surgeon, do you get nervous, like when you go into you walk in to the operating theater, there's chaos going on, somebody's life is in your hands and so forth. And the surgeon, with no arrogance, said, no, I don't get nervous because I'm the best chance they have to live. And that mentality about it is one where he's prepared for that. And he's created that mindset for when he's in the game, he is all the way in the game. And so I think about you and your fellow physicians, athletic trainers, and so forth during the game. You have to it seems that you have to have that mind, right? That I'm the best chance this person has to minimize injury, to be taken care of, et cetera, as you go in. That's a different mindset than you would have as a regular outpatient physician, right? And so how have you learned, or is it natural to you to have that mindset? I'm in a high pressure environment, no problem, I'm in the game, right?
I think when the task at hand is described for you, when you try to translate what you do in your day-to-day practice to what's happening on the football field, you know what? The stakes are very high. Mm-hmm. And your ability to focus in on what's happening on the field and not necessarily worrying about what's happening in the game is paramount. Getting back to our athletic trainers, if you watch everybody and if you watch them on the sideline, they are scanning the fields all the time. The play may go 20 to 30 yards down the field. They're also looking back to see what happened at the line of scrimmage. Is there anybody down? Is there anyone having a bit of a problem? Is there anyone slow to get up? So the athletic trainers, the physicians, the other non-team associated physicians that are on the sideline, everybody is looking and watching because nobody wants to miss a thing, and they're dialed in to do it.
It's interesting. So this friend that I was talking about, Bill Holcomb, he and Mac Rubley, both athletic trainers, used to talk all the time about the mechanism of injury. And you were reminding me of this because they would do exactly as you're saying. Somebody would get hurt, and what a person like me would see is somebody's laying on the field. What they would see is the mechanism of that injury, which then suggests what the actual injury is. And so the level of understanding, I've got to imagine that you're exhausted after a game, paying attention, to everything that's going on in that kind of an environment.
It's in the beginning, it gets exhausting because you don't ever want to miss anything. And again, I can only allude it to what I was doing in the ICU. My job today is to help my team take care of these players and make sure that they're safe and they kind of get through it. And so over time, it changes. There's more technology now. So getting back to the mechanism of injury, there are so many cameras on the field. And just to give you an example, like if somebody gets pulled off the field for a concussion examination, part of the process of evaluating for someone for a concussion is to go back and watch the video. The player's not allowed to go back into the game. They're getting prepped for a brief examination. Now, if it's a clear-cut concussion, they go to the locker room. But if it looks like it's gray and we're not really sure, the team physician, along with what's called the independent neurotrauma consultant who's on the field, will go and look at the film together. There's a third person up in the booth who's also looking from above to give you real-time information. And you're taking that mechanism of injury into the tent or inside the locker room with you to see exactly what happened, so you can really drill down on the mechanism of injury.
It's amazing how technology is being used for this and in a beautiful way. You mentioned the tent. Can you talk a little bit about the blue tent?
Sure. You know, the blue tent has been around in the collegiate level of sports for years. And one of the concepts was that, well, when we examine our players, how can we do it in privacy? You know, it's like you go to your office, it's the provider, and it's the patient. So by using the blue tent, you're creating privacy, and that was really the original intent. So if you're doing an exam on a concussion examination, or whether you're doing an exam on someone's shoulder or a traumatic injury, you can do it in privacy with the few people that kind of need to be there. It really helps.
Yeah, I noticed during the Super Bowl this year that they would bring the blue tent and put it over the individual that they were looking at. I had never noticed, by the way, until you told me about this, the blue tent. So speaking of injuries, by the way, what are some of the crazy injuries that you've seen?
You know, I think there's been the usual set of bone breaks. I've seen major chest trauma, rib fractures, a condition called pneumothorax, which is when the lung punctures. It's a balloon, basically, and it leaks air. That could be life-threatening. You can get into abdominal trauma, liver injury, splenic injury, kidney injury. So those are kind of the nature of the sport. It's a contact sport. We've been fortunate over the past several years to not have any hospitalizations that would require this, but we've had trips to the hospitals to make sure that someone didn't have anything dangerous as such. There have been other conditions over the years, and getting to the medical side. And I can tell you a story back in, I think it was 2012 or 2013. I was coming back from the NFL Combine, and I received a phone call from one of our players. And he said, Doc, I've had this fever, and I don't feel good, and I have a sore throat. And I said, okay, I'm going to be landing in tomorrow, and can you check in with one of our athletic trainers who's been there? So he went in and checked in, and it turns out, which gets back to communication and learning, that he had been in a hospital maybe 5 to 7 days with the same complaint, had a fever to 105 degrees.
105?
Yeah.
Wow.
105. And once I heard that, I said, get him straight to the emergency room. And we evaluated him, and he had developed a condition called Lemire syndrome, which is a very rare condition that occurs in the back of the throat. It's basically when you develop a clot in one of the blood vessels behind your throat that can embolize to other parts of your body. It's associated with certain types of organisms. It could be life-threatening. It could be career-ending. We were able to identify that early. He spent about a week in the hospital, and he did fine. But it was one of those things that, you start out with, it's just a sore throat, right? What else can it be? Which gets back to, unusual presentations of common situations, right? That was one that we see. You don't see that often. You have to keep it in the back of your mind. You'll also find other situations, right, where, and remember, these are, on average, the players are very young and they're very healthy and they shouldn't have medical problems. They've gone through a robust screening process. I've had situations where I'm walking around very early in a visiting team environment, and I come across one of my players. He doesn't look right, so I'll go up and I'll ask them how they're doing, and someone had an abdominal discomfort and said, I've had it, and and it kind of comes and goes, and it's been a few years, and I just didn't like the way that he looked. So when we got back to our facility, I examined him and I tested him, and I really couldn't find anything that was wrong, and I explored it a little bit more and sent him to a stomach specialist, and turns out he had a very severe case of ulcerative colitis, which is an inflammatory bowel disease. That was in, I think, 2015, and to this day, he still calls me wherever he is, checks in with me, makes sure he's doing okay, and just says hello. So you come across things that are unusual from time to time, And you have to be ready to make sure that this is not just something out of the run of the mill, if you will.
So one of the things that's really interesting about the answers that you just gave is I didn't realize this, but I sort of had this bias in my head that I was thinking about on-field injuries and so forth. But those two that you just described really have nothing to do with football per se. And yet, so you're taking care of the human being who happens to be a football player, as opposed to taking care of the football player.
That's right. We don't distinguish between the two.
Yeah, and I think that really, to me, is a critical point because, going back to those movies, right? Going back to the public perception. Public perception is you're taking care of a football player, but you're not. You're taking care of a human being, and that human being's job is to play football, right? And it's a very different perception. These football players, these human beings, by the way, have changed over the years as far as, some of it's nutrition and diet and exercise patterns and so forth. What changes have you seen over the years for football players?
I think on average, you'll see that if you compare the average size of an offensive lineman dating back to the late 80s or early 90s to now, there's a discrepancy in size, in strength, and speed, and these players are really, this is their craft. They're super athletes. They're really pushing themselves to be the best that they can be. So you're seeing people that are they're incredible. If I even could give you examples of their strength, just on a day-to-day basis, they're incredibly strong and they're incredibly mobile. It's amazing to see actually that type of physiology.
The combine or the draft rather, is right around the corner, and seeing some of the 40-yard dash times and the bench press and jumps, and so it's amazing how it's changed over the years. This is as you said, a full contact sport. We know that it's dangerous in some regard. Certainly, TBI, traumatic brain injury, is something that I want to say is prevalent, but certainly is present in the sport. What does the NFL Players Society do as far as injury mitigation? And do you feel a conflict? Sorry, this is a long question, but do you feel a conflict in you're working with athletes who are in a sport who have some inherent danger to what they're doing, right?
Yeah, so I think the NFL and the NFL Players Association together, that's the players union, if you will, they have really embraced the concept right around the time that I started and really amplified it shortly following, that everything that we do puts health and safety in the center, full stop. Concussions, are a big deal, and we always worry about that, but there has been so much science, so much focus on how do you prevent concussions, and how do you get players back safely to play. The NFL was a situation many years, even before me. I think when it gets back to some of those movies, it's like, well, someone can get back on the field and we're not really sure, and how do you really evaluate those people? That is now a complete 180. I think we have a very robust protocol that brought together national experts looking at the science to say, how do we kind of do this? The protocol for evaluating players on the sideline, if you just take a game and you look to see the amount of people that can call a concussion. So did you know that if there is any suspected concussion in a player, who can call for an evaluation? It's anyone. The player can self-report. A teammate can report. A referee can bring someone over. A coach can bring someone over. Anyone on the medical staff can have someone over. We have up in the booth, way above the field of play, you have the athletic trainer spotter, whose only job is specifically to look for concussions that may arise. So this used to be that, you don't really want to go out and we're okay and that's not how it is anymore. Mm-hmm. You now have players that are self-reporting. He said, I don't feel good. And when we start that protocol, if we even feel that there's anything remotely possible for a concussion, we remove them. We may test them in the locker room with our unaffiliated neurotrauma consultant to see if they're eligible to go back or if they're really finished for that game. That's just for game day. And then if they were diagnosed with a concussion, there's a very robust return to play protocol that starts from the following day. You watch for symptoms at rest, you watch for symptoms with activity, you make sure that people are kind of back to their baseline, you make sure someone sees a specialist, and you follow up with the team physician who knows you the best to make sure you are back to where you should be. So you're seeing the culture of players and the environment of NFL teams change to make sure that, hey, this is a big deal and we all know it. That's one. Number two, if you look at what the NFL does, at the beginning of every year, the players have to watch, to be a part of a 60 and 90-minute didactic on everything involved from health and safety and things that can affect them. One of them is very clear on using the crown of the helmet. This is the risk that you get if you use the crown of the helmet, and this is what a proper tackling mechanism is. You've seen now that they've put in penalties to penalize players when they try to spear people. It's because you want to protect them from a concussion or an injury. Mm-hmm. So there's a lot of safety mechanisms that are kind of built in. I mean, that concussion protocol that we speak of, every year it gets evaluated. Every year it gets, what else can we do to make it a little bit more safer and a little bit better? And we learn things as the season goes by, either from the NFL itself or from other teams that happen. And things get, if they're worthwhile and they're going to improve the game and safety of the game, they tend to get incorporated sooner rather than later.
And a lot of this, I'm not going to make an assumption, I'm going to ask. A lot of the advances that come through the NFL are shared with other sports as well, and vice versa, correct?
Yes. I can tell you it was maybe 2 or 3 years ago, I was part of a contingent that got to go to the UK and meet with Major League Soccer. And one of the questions that they had was our concussion protocol. It was so robust and it was so data-driven that they were starting to think about the same things. And they wanted to learn from the NFL, not only from how do you implement it, how do you change the culture amongst players and teams to understand that this is now important and we need to do things about it. And they weren't really there to kind of say, well, we're going to make these changes right away, but they really wanted to learn and take away what they could from the NFL. And like all things, it's a protocol. It's not perfect, but as long as you try to make it perfect as time goes by, that's the goal. So other sports leagues look towards the NFL to try to say, what can we do? Because they've already done it.
Mm-hmm. It's interesting to me, the culture piece, because there certainly when I played football, there was a culture of if you had a concussion, you did everything you could to hide it so that you could get back on the field. And it doesn't sound like that's the case anymore.
Yeah, I think the culture is evolving, and I think you're now seeing, when you see players for the first time say, hey, I need to get checked out, or if you see other players worried about their colleagues, yeah, the culture is changing. Will you still find players are trying to hide it because they're so competitive and that's what they believe in? Yes, but that's really the job of the athletic trainers and the physicians who know them the best to help tease things out and say, hey, we need to kind of make sure you're okay.
I want to switch gears for just a minute and talk about partnerships, because right now you're talking about partnerships across the physicians, partnerships between physicians and athletic trainers across different types of sports and so forth. Sports medicine is a rapidly growing field. So I'm going to ask you if you could talk about that and then also talk about the partnerships that are necessary to continue that growth.
Sure. So when you think about a pro sports team, it's really an organization, right? You have players, you have staff members, you have coaches, you have a business side, and you have an administrative side. And a professional sports team in the NFL, it's a big deal to a community. And you want to bring in people that understand the nature of what we're doing and how we make it better. Now, you can't go to one, it's not one size fits all. You want to go to places and find people that can make you better. I've never been one to say that, well, we work for this organization, so we're only going to use these people. No, that's not how it works. You find the people in those organizations or in those communities that can make you better, and they're out there. And whether it's from mental health, whether it's from physical health, whether it's from things like cardiology, or you name the list of things that you need to name, or whether it's UNLV Health. We had a great collaborative meeting here sponsored by UNLV Health a few months ago as part of our Super Bowl. You find the diamonds and you take them and you incorporate them into everything that you do, and you're one step higher. And I'm proud to say that collaborative effort, whether it was in Oakland or in Las Vegas, I think we've done a really good job, and we continue to mine our diamonds to make ourselves better.
I thought it was a huge success, actually. You know, one of the collaborations that you have is with an internship program that you have for underrepresented individuals, which I also think is fantastic that you do. Can you talk about that a bit?
Sure. So that's an NFL pipeline program. It's to really bring students from diverse backgrounds into the NFL ecosphere, primarily targeted at third or fourth year medical students that are interested in entering a career of sports medicine. 2 years ago, it was a pilot of maybe 6 or 7 teams that were primarily there, and it was successful. And so it was expanded to all 32 teams across the NFL last year. And basically, you're bringing in a student, and you're exposing them to what an NFL team looks like, from the athletic training room to a physician room to a practice field and to game day. And you really want them to get a good understanding of what it means to be a team, of how we work as a team. And when you leave the environment, you want to feel like you've really gained something and you've left somebody better than when they came to you. And it's been very successful. I know you know Amy Weiss. She's the director of the NFL Physician Society. She is the point person that has really amplified this program across the 32, and the teams have really embraced it.
Yeah, Amy, by the way, is Superwoman as well. Amazing person. I think that, so we'll leave a link about this because I think it's really important if people are interested in looking into it. It's a great program all the way around, and I can see it expanding as sports medicine is expanding. Let's talk a little bit about sports medicine because it is very different than it was a few years ago, right? It is essentially, you've mentioned the mental side, the physical side, there's so many aspects to it. Can you talk to us a little bit about what you see as sports medicine now and where you see it going?
Yeah, I'll rewind the clock a little bit, and I think before, sports medicine was primarily in the purview of orthopedic surgeons, right? They're the ones that deal with broken bones and take care of people that are engaged in such things. And over the past, I would say 15 years, the advent of sports medicine as a primary care sports medicine has evolved. That allows people from a medical background to participate in sports medicine. UNLV has a great program. We have team physicians that have come from UNLV that allows you to be on the field, that allows you to understand everything that's relevant on game day and from a head-to-toe fashion, not only at the NFL level, the collegiate level, the high school level, the recreational level. We have teams coming in, we have sports coming into Las Vegas, rugby, for example, or Major League Soccer, or some forms of soccer that are coming in. It's really, really, really growing. So on game day, you want to be able to help those organizations that prepare for when they visit you. And then on the other side of it, you want to be able to take care of your own players and your own staff like you would anybody else. And remember, you could have COVID. You could have a sore throat, like things that we had talked about earlier. You could have a blood test that does not look right. You may develop asthma. I mean, there's a whole host of things. You could, true stories. You have players that are off on their vacations that may have been surfing or on an ATV accident, and then we learn about this as we're right about to start the season, and we bring them in, and we have to look at all those things. And so taking care of the player holistically is the new paradigm.
It's a big shift, right? Because thinking, again, back to the idea that taking care of the human being who happens to be a professional athlete is very different than taking care of the football player. And so it also expands what is sports medicine, right? It's medicine within sports. There are uniquenesses, though, that you deal with because you're dealing with elite level athletes. Can you talk about a few of those uniquenesses?
Yes. And I think when you have athletes, this is their career. This is what they do. So nothing really becomes too large or too small. If somebody comes to you and says, I'll just use this as an example. I have a hangnail and I'm worried about it. Guess what? We're going to address it, and we're going to address it the right way. If somebody has something very simple that we think may not be too concerning from a medical standpoint, we will make sure that we treat it the right way so that the person on the other side understands that we addressed it to the right way. So there's a whole host of things like that. If people have concerns and questions, like COVID, for example, I think, as much as we've been through COVID, a lot of questions came up, not only for players. What about cardiac disease? What about their families? How do you isolate from COVID? And how do you do that away from your family? What about someone's family member who's in another state? So we take our players are our patients and we treat them the same way. So we treat them holistically. We have our nutritionists, we have our strength and conditioning team, we have our athletic trainers, we have other performance specialists that look at these players in one way now, not in silos. We really like to be good about saying, how are we looking at this person together and communicate in the same voice? Whatever it may be, we're going to try to address it. They may have questions about supplements, or they may have questions about bee pollen, whatever is out there. We're going to make sure that we're available to them so that we can alleviate any concerns and help optimize their performance the way that you should moving forward.
You're dealing with people whose livelihood and passion is around their ability to perform. And so you mentioned bee pollen, but there's CBD, there's ice baths, there's all these different things that, at some point look at as alternative at this point. Maybe mainstream ice baths is a really good example of that. What alternative avenues do you have for rehabilitation, for medicine and so forth that you've been able to use?
There's actually quite a lot. Using your example of ice baths have been around for a number of years, right? Whether it's on game day or whether it's in our facility. You have newer ways of cooling the body, if you will. You've seen these cryo chambers that are kind of there. There's a lot of good science surrounding cryo chambers, and we always look at things as something that may help, that may not hurt. Once you get into other things like CBD, there's a lot of controversy around CBD, and no, it's not to say that should we be using CBD today? Well, we haven't really seen the science pan out yet. The NFL, as part of their health and safety arm, looks at a lot of these specific issues. In particular, one of them is CBD, and they have an entire committee looking at the science and the data to see, is this something that we could potentially use in the future? So we look towards the NFL because they already have a lot of source of truth. And if we don't see things that are out there, for example, I'll use another one like hyperbaric oxygen, right? I'm someone who's practiced hyperbaric oxygen. I think many people don't understand what that means. Can it help you? And depending on what you're trying to do, what does the science say? So we quickly go back to what the science says. What is the NFL doing in relation to some of these things? And then we come out with consensus, and then we bring that back to our players.
So do these things translate into the general population? Have you seen them translate for this? I'll just give you an example of this. My dad worked for aeronautics company. They worked for NASA and so forth. And a lot of the things that they developed for the space program then made it to the general population, like Velcro. And we've seen that elsewhere. Have you seen that in the NFL as well?
Yes, I've seen it at the collegiate level, and it even trickles down to the high school level, depending on how competitive your high school is, right? There's several high schools in this country that are powerhouse high schools that are, many of their players are.
We have one here.
Yeah, absolutely. And, there's a lot of things that you can do that are very easy, like, getting back to the cold baths and the cold tubs. And you take some of those things that are very helpful, right? And you're able to translate it over. But what we don't want to do is to take things that aren't proven, that people are doing on the side, or that are one-offs, because we don't want anyone to get hurt, and we don't want anyone looking back at us and saying, well, that's kind of where it started from. So we're very strict when it comes to some of those things.
So along the same basic line of alternatives, sports, professional sports in general, have had a history of individuals having performance enhancement drugs, PEDs. I actually haven't heard anything lately in the NFL about that, but what's the current status as far as the NFL is concerned?
The concept of performance-enhancing drugs, so getting back to that talk that I mentioned to you at the beginning of the NFL season, one of the topics is this specifically, and there is a line that all players see, and it says, athletes are 100% responsible for what they put into their body. There's a list of banned NFL substances that are plastered all throughout the locker room, on the website, and there's a governing body that oversees PEDs. So everybody knows that, hey, you can't do these things. They get tested routinely and randomly throughout the NFL season. And if something is picked up, it doesn't matter what you said. Well, I got this from a credible source, or I was back in this state and somebody gave it to me, and it doesn't matter. You're ultimately responsible. And that's why we tell our players that don't take anything that you may have second thoughts about. Run it through us. We kind of know what's been vetted and what's not been vetted. So there's a very robust way of that. And sometimes when you see things that, you may hear something in the press, many times somebody was on Team A and they moved to Team B and they just kind of forgot that they had to renew something if they were taking a medication that was appropriate, but it didn't go through the proper channel of renewal outside of standard PEDs.
Yeah, I mean, I think the what we're talking about here is people trying to get an edge any way they can, and it's so competitive that sometimes they're going to step over the line. So, and you being the NFL, doing everything you can so that people are not stepping over the line, but also adding a layer of personal responsibility to it. Does that sound right?
That's correct.
Yeah. So I've got a few rapid fire questions for you. So one of them is, you mentioned earlier about breaking bread with fellow physicians. In Las Vegas, where's one of your favorite places to break bread?
Joe's Stone Crab, Caesar's Forum Mall.
I just heard, I can't remember what specific dish it is at Joe's, but somebody was saying how good it was. What do you get there?
I usually get a fillet of some sort. I've, as one of the other things is being a part of a professional sports teams, we travel and you get to go to a lot of restaurants in a lot of different places. I find Joe's Stone Crab to be spot on in every way, shape, or form, whether it's service, whether it's the food, whether it's the ambiance. They really do a good job.
Yeah, you didn't hesitate very long when I asked you that question. Okay, we talked about Las Vegas and sports medicine. You are going to be our Nostradamus. What is sports medicine going to be in Las Vegas in the next 2, 5, 10 years?
Wow. I think sports medicine in Las Vegas is going to continue on a vertical trajectory in Las Vegas. I think with the Las Vegas Knights winning championships here, the Aces, the Raiders being here.
Go Aces, go Raiders.
The UFC, the potential of having Major League Soccer here, the potential of having an NBA team here. You hear the buzz, not only here, you hear it everywhere. You have summer leagues here, you have G leagues here, you have people coming here regularly outside of pro sports leagues trying to get a finger on the pulse here. I think Las Vegas is going to be one of those places, not only in the United States, but in the world, that everyone's going to look at, oh, that's happening in Las Vegas, that's where it is.
I agree with you. I also think you can't bet too big on Vegas.
Agreed. And I think when you get back to Las Vegas and how it continues to reinvent itself one way or another, and when you think that, however Las Vegas came to be, sports is now a big part of it. And sports will continue to be a big part of it, just because of the infrastructure here, the desire here, the school of medicine here, and all of the eyes on the outside looking in. It's going to go in one direction, if you ask me.
I don't know necessarily that there was a master plan, but you're 100% right. It is absolutely exploding. And look, having world championship teams like the Aces and the Knights, certainly that helps. But this city loves sports, and people love to come here for sports as well. And sports medicine is part of the fundamental infrastructure of that.
Agreed wholeheartedly.
Yeah, so excited about it. So we'll have world champions in hockey, basketball, and soccer and baseball. We've got them all covered. Football, of course.
Football coming real soon.
Yeah. Okay. Okay. Saturday mornings. Outside of football season, where would we find you at 10 a.m.? What kinds of things do you do in the morning for yourself?
So there's probably one of two places. The first place would be in the intensive care unit rounding, because the intensive care unit doesn't sleep. It's 24/7, and I still practice critical care medicine. In the second place, if I'm not working, I'll be at the soccer field with my 12-year-old, watching him prepare or train or get ready for a game.
And not riding his skateboard.
and not riding a skateboard.
So this is a good lead into this next question. I'm going to say you can only use your 12-year-old as one of the answers here, but a few moments of joy that you've had in your life.
A few moments of joy is number one, both of my children. I think one thing I try to instill in them is a lot of what we've talked about here is to be good human beings. And I'll give you an example of my older son who's a freshman in college right now. When he was in the 6th grade, well, I'll take that back. When he was born, he was given a piggy bank by somebody for his birthday. And over the years, anytime anyone who gave him any kind of money, he would put in that piggy bank. And that was fine. And then one day, I think when he hit the 5th grade or the 6th grade, we got a call from his teacher. And I was taken aback because why is the teacher calling on so-and-so? And she said, I just wanted to talk to you. Your son came over today and he donated about $400 to the Diabetic Association of our local Diabetic Association. He didn't tell his mom or he didn't tell me. He did it because he heard a lecture on diabetes and he found that I need to help people and this is a good way that I could do it. And he did it in a way where he didn't tell anybody. And that made me very proud to be his father at that moment. And he continues to do things like that. My younger son is not much different, if you will. And I think outside of that is my wife. My wife brings me great joy. I have to say that she is my best friend, and we are completely aligned in how we live our lives. We're very different, but we're very similar. And it makes, without her, I couldn't do any of this or half of it. And her caring and her compassion and trying to allow me to do these things, while trying to be a dad and a husband and all these other things is a special thing for me.
Yeah, beautiful answers. Thank you for sharing that. Your son that's freshman, what is he studying?
He's in pre-med.
Okay.
Yeah.
So on his journey, let's say, for example, you were his dad and you're going to give him advice because he wants to go into sports medicine, what advice would you give him?
I give him the same advice I give for anything. I say, we're all human beings. Be as humble as you possibly can be in your life. Work as hard as you can and suck it all up because time is going to go by very quickly. And if you bring yourself at the top of your game, doors will open up for you and you will be who you want to be.
I could talk to you for hours, but I'm not going to go beyond that. That was beautiful. And thank you so much for being here. Your wisdom, your insight, your humility as well. I'm incredibly grateful. So thank you.
Thanks for having me.